Hi, Josue. How are you? Why don't you tell us a little bit about yourself, where you're from, when you came to the United States, just some general stuff. How old are you? And yeah.
I go by Josh. Just so people don't have to work so hard. I am 37 years old. I was born and raised in Brazil. Came to the US to go to college at around age 18. Um, Landed in Texas, the north suburbs of Dallas, Texas, and that's where I went to school for about 5 or so years. Community college, music, and came following my dreams. Didn't come from all the details ready to study, so it was more of like an improvisation as far as financial situation. Had to kind of like make my way through paying college, figuring out how to pay for it. My parents weren't loaded, just sending me money from Brazil. It was kind of like a survival thing. My passion was for music, and I really wanted to study. And if I ran out of money, I was just gonna go back. After college, coming to Minneapolis, I met a girl, and married was my first marriage. Our lives started in Minneapolis, and that's where I started really working as a professional musician, where I met my friend Cassie.
If you met me
Oh,
before 2006, then yeah, I'm definitely Cassie, huh?
Cassandra.
I'm kidding.
So playing music, a full-time musician, just became an American citizen last fall. Um, I was
Woo.
maintaining my green card, which is a permanent status for the last 12 or so years.
What is the healthcare system like in Brazil?
Brazil is what they call developing country. I live in the state of São Paulo, which is pretty advanced compared to the rest of Brazil, where it's not like anything like the Amazon, or there's like big developed cities, access to hospital, access to sanitation, all that stuff. The class despairing of social is very big. So there's some people that have like a middle class and a rich, like a lot of money, and then a big amount of people that doesn't have a lot of money. I can say that I came from sort of like a middle class situation. I had access to healthcare. My dad is a preacher. We weren't rich, but we always had healthcare programs like that you pay monthly, like we do here, insurance.
Okay.
So I never had to worry. I was never in a nervous situation where I didn't know what was going to happen. If I had a procedure to be done, which I did when I was like 5 or 6 years old. I had meningitis, and I was interned in the hospital for like a week. Uh, I never felt like hospital and bills were a stressor in my family. So that's very important to note, because that's not the same case for a poor person in Brazil. Because my parents were preachers, we had a lot of different health professionals that were close friends in the church. So it was more of like, oh, you have something in you have like a cold. Let me call this person, and we would through our insurance be connected to them, and be seen. For somebody that's less fortunate, big lines waiting in the hallway to be seen for emergency things. Sometimes some hospitals, depending on where you are in the city. So my case is not a perfect case of every Brazilian. It's more of like somewhat privileged. I had a lot of trust in the doctors that we did see growing up.
Is that because you had more of a personal relationship with them?
Between my parents being able to maintain, it's called Unimed at it's the state of São Paulo in Brazil. Health insurance system. It's got
Okay.
a network of
Mm.
use. And then also personal connections. For little things, we always had somebody we knew. If it was available, like my parents' friends, like we went to the hospital, so and so, he would tell me, hey, come so and so, because I'll be working then and I can see you. There were cases where I saw somebody I didn't know. The general impression that was left in me when I came here at 18 is that I would go to the hospital or the doctor to be seen, and they would get to the bottom of what I had and
Hmm.
fix it. It felt like these people were very brave. Not always the best facilities, not always state-of-the-art equipment and all that stuff, but these people were very knowledgeable.
It sounds like to me there's kind of a similar it's similar to the United States.
My impression, the contrast was huge because it felt like as soon as I would go to the doctor, right off the bat, I had to out of pocket a lot of money that I wasn't making. And I'd always felt like I left without no more assurance of anything that I had before I walked in.
So that you
It
didn't
was,
feel like the treatment didn't match the actual pricing.
yeah, and it was almost like they were afraid to tell me what I had because they didn't want to be liable. That part was really big for me. It's like, oh, you know what I have, but you're not supposed to tell me unless I have all these tests done that would all cost me.
Mhm.
And then you tell me maybe you have this. It's almost like there's no guts of like at the time I had that impression. Oh, you don't have any guts to tell me what you think I have and just prescribe me a medicine because you have to have me test for this, test for this, test for this,
Mhm.
test for this. And then I pay all this money and you came back, oh, you had a cold. I don't have any
Sure.
money. I go in because I need to. I pay a lot of money. I come out. I might as well have Google the answer that I needed. In general, they look they look at what they do like this. So if I have a problem with my feet, like I kind of have a good idea, plantar fasciitis or something like, something on the tissue of my feet. I can't just go to like a specific foot doctor. I have to go to my general doctor. The general doctor will charge me all this stuff, and they have to recommend me for this foot doctor that will also
Mhm.
charge me. It's like I know it, like like
Mhm. So
I
you're saying
Googled
there's a
it.
lot of like roundabout ways where we could probably,
Streamline, like have
yeah, just go straight to it.
yeah. If you have a good doctor, that's a good general doctor, that's trusty, that's been in the business for almost 50 years, they might take some chance and tell you what's up and
Mhm.
give you the medicine right there. But if he's any like kind of like unsure, he's gonna give you the roundabout of tests and send you to this specific person, that specific person. Autumn has been going through that. They sent her to like four different specialists and she still didn't have an answer. When
Sure.
if we didn't have insurance, we would be broke. You
Yeah.
know, I can tell you that I didn't go to any doctor or any hospital anywhere forever because the first time I think I had like a big infection throat or something in college, I didn't I asked around people from the church I was working at and they told me I went, and then when I saw the bill just to get in to see someone, I was like, I don't have that kind of money. Fortunately, I never had an emergency. Even coming here to Minnesota, by then I had a green card and there was this thing like you had to have health insurance, otherwise they would charge you on your taxes.
MNsure? Yeah, MNsure was like you're covered under your parents until 26, and then after that, um, I had MNsure because I didn't make enough money, and they
Mhm.
would they would ask me questions about that on my taxes.
Obama rolled out something that you would go online and you would get, and you would like sign up for health insurance, and you would get, depending on your income, certain amount, and it ended up being somewhat like 150, 250 a month for me. And I remember my copay was super high and all the rules. I just like, you know what? I don't get sick. I just bypassed it. And then little did I know, I show up to pay my taxes. My tax person is like, yeah, you have to pay this much because you weren't insured. So it's like, oh, I could have been insured and then I wouldn't have to pay. I'm painting a picture of more of a negative view on health system, but that's more in ways of finance, in ways of like the big guns, the big hospital corporations, their agenda, and the middleman being the actual health provider who has all the intentions to do the right thing and help the patients. And
Mhm.
then the way the system works, how you have to work your way through it so nobody's liable to anything, ends up being the weak link on the patient who doesn't have a situation like mine, ends up being somebody that doesn't have um the means to be able to withstand going through the system. And then we were about to talk about a specific case of a friend
Mhm.
that was also a musician,
Yeah.
And just to clarify for the interview's sake, musicians are self-employed. You know, we have to go and pay for our own. Nobody's coming in and like paying like included on your paycheck.
I've been paying my own disability and putting in my own retirement
Yes,
and paying for all of my life insurance since I was 26 years old out of pocket.
just for the sake of clarity, in case people who are seeing that don't know what it means to be a musician, you know. So a friend of ours that was a musician her whole life, much older than us,
Mhm.
went through different periods of this country's health system. It ended up in an unfortunate situation with cancer and couldn't afford the health care and
Mm-mm.
just refused treatment until she passed. You
And
know,
it was,
very in a very sad,
mhm,
um, not fast,
it was very
you know,
slow.
very slow and suffering. We saw her fall apart.
We
You
saw her
know,
deteriorate.
when you see cases like that, when there was no help, you know, like it's in, and she wasn't one to be very vocal about it. There's some people we see they go into some like GoFundMe, and then you see the case in front of your eyes where they're telling you how much money they have to pay a month just to be able to get treatment, and they're waiting for the friends to like chip in, and if they don't, it's like, you know, yeah. Today I'm in a much different place.
And you have a son.
Yeah, I have a
He is
little
so
boy. He's
cute.
almost 2 years old.
What does your wife do?
She works in ophthalmology for a major hospital chain. She's a tech. This is her third job in this field, and she's been climbing, getting certified for different things, and she's really happy with what she does now because the biggest perk, this being a big provider, is the health insurance for our family. Go from being single, not being able to afford health insurance as a musician, to like my wife being able to provide for our whole family, a really awesome low copay insurance that we don't have to worry about anything.
Mhm.
It's like a
Is it
night.
private? It's a private insurance?
It's Health Partners.
Oh, okay. Yeah. So,
So
yes.
it includes therapy for like, mental health. It includes dental and I went to the dentist for the first time in the US in the last 2 years because I would
Wow.
I would go to the dentist when I went to Brazil, and I would go see the people I knew in Brazil and
Mhm.
check on my teeth.
What are your wife's thoughts on the healthcare system? Does she ever disclose that to you?
We feel like we're the luckiest people alive. Like for instance, Luca was born almost 2 years ago. It ended up being like nothing worked. We're gonna have a C-section, and then the recovery time for the C-section. So somewhat traumatic in the beginning, and then really great experience at the end. But the week of the delivery and recovery of her body, the bill came in the mail. It was like $90,000.
Woo!
We didn't pay a single cent of it because insurance covered it. It's insane. And I was looking at her, I was like, we are so blessed to have this.
We have a very big like Somalian and African American culture in Minneapolis. And could you imagine being statistically a single Black woman
Yeah,
with maybe a father who wants nothing
yeah.
to do with it, and her going in and getting pregnant and having to have this baby? Like,
Yeah. And side note, Autumn got this bill. I didn't get the bill. It was in her name. If
sure.
she wasn't, the female gets the short end of this. Because like if it was the case, I wasn't interested in the baby, whatever, she would be left with this
Yeah.
bill. It wouldn't be on my record.
Yeah.
Fortunately, right now I get to be a stay-home parent and take care of him during the day. And it's hard. It's somewhat of a financial sacrifice because music, it's cyclical.
Hmm.
Winter is very slow. Um, but I can see. the quality I get to give my son by giving him attention and being here for him, and it's priceless. So
Yeah.
I'm getting like a firsthand taste of like a non-sexist life. I'm a total house husband, and I was not raised like that. I came from a place where, we finish eating, the women get up and go clean dishes, and the men stay and talk on the table. Um, you got home from work in the middle of the day, and lunch was served, and you had dinner served, and it wasn't men doing it, you know. And now, like, I am very happy to be able to serve my family. Sometimes I miss my mom's um care. My mom's cooking, like
You're
Easter,
like,
like
mom.
if I want it, I need to cook it. And that's not because Autumn can't cook. It's just that like we have this arrangement. I'm not paying a mortgage a week just to have my kid be sent to daycare. Nothing against daycare, but like I'm happy I don't have to do it right now.
Yeah.
So
What do you think about me going from a musician to being a paramedic?
I I respect I respect you a lot. I think that it's not just you going from a musician to being a paramedic. It's you being going from a musician in Minnesota to living in Wisconsin, being a farmer, then a paramedic.
You have seen
You
me do
follow
some crazy stuff.
you follow your heart and you go hard, like that's very commendable. I'm very impressed. And if it makes you happy, if you feel fulfilled in your life, you're doing what you're supposed to do. I mean, you have mad talent in music, you can come back to that anytime. You don't have to stop, and I know you haven't stopped. um but that's great. You're giving back to the community. You probably hopefully getting paid better, better situation.
It's
It,
really
it's
benefits
it's
I'm going for.
security, family security. Like you have a daughter now. You probably think of things differently. I have a
Mhm.
son. We're trying to make another. Where
Yay.
the priorities change completely. And then you have hard things to think about. I'm thinking about those hard things too.
People aren't prepared for mortgages. They're not prepared for when you go to college and you take out all these loans and you realize that after 10 years, you've only paid $1,200 to your principal, and the rest of your $700 a month that you were paying went to interest, right? These systematic things. People wouldn't get so stuck and, oh shit, if we educated them. When did you learn how to do your taxes? Because I was like 19 or 20, right? I didn't know how to do a mortgage until I was about to buy a house. I didn't understand that putting money away myself at 20, even if it was $20 a month into a mutual fund or a Roth, I would be exponentially more wealthy than I am now. And these things are not taught to us in school. It can just
Yeah,
be like, here's what it is. And through that, almost like the next generation, they would be able to come up and problem solve with new systematic approaches. The thing is people
yeah.
don't understand it, so they don't know how to change it. They don't know how to talk about it. I don't know. Maybe there would be a big difference.
Education on one end, corporate profits on the other end. Why is it that on the year that the earth suffered the most in the last, as we know it, in the last few decades, why is it that the profits were the biggest? The hospitals didn't cut their profits.
Mhm.
They just increased, and they keep fighting the unions because they're no, there's no cutting profits here. So if I'm a little guy, I need to get treatment. The doctor is willing to give me their care. The state is willing to fund. Why can't the hospital match the profit and cut the profit a little bit for that person? If this person is also more prepared with education from an early, they also know how to prevent things. There's less things in the system, overloading the system because they know better. They prevented, they didn't get that far. Whether you call it like,
Prevention
you know,
measures are huge.
there's so many things like obesity, Like so many things that if we were more prepared in the early ages, there would be a lot less weight in our system.
Yeah.
But they don't.
And
They
this is
don't.
all education, in
Yeah.
my opinion.
But I'm bitter, and I'm all for capitalism, but I'm bitter as to the greed, corporate greed of not like when the world is suffering, we're going to take one for the team too. It's no, the world is suffering. Let's see what other opportunity we can get here when nobody's looking to make more profits. That's how it feels. Everybody that I go see, the doctor, emergency room, I see a lot of honest people that really want to help, that really care for me, but I feel that their hands are tied to a degree with the system they're working in.
Mhm.
And that's the part that makes me skeptical in general.
Let me ask
Yeah.
you this. If
Yeah.
you had an emergency with your son and you needed to call 911 because it was something where like you didn't want to put him in the car seat, right? And it was a real emergency, would you feel safe, taken care of? Would would you not call because of uh a financial burden?
Right now, I would definitely call. We have access, Autumn's insurance, like I would call. Would it cross my mind how much money would it be to activate the services? Yes, it would definitely cross my mind. Would it be a bummer? Yes. But if I had to save my son's life, I'll get in debt for it. You know, I would just be crossing my fingers that the insurance would cover most, if not all of it. But if you asked me that 10 years ago, I would have I would have walked my son to the hospital. Yeah, because there's somewhat of
Strictly
like
because of the
yeah,
financial burden.
financial, like not a financial like, oh, this is worth my money. No, it's a financial exploitative.
Mm,
That's the part that is frustrating, right?
sure.
It's
Yep.
like, oh, I'm giving you money, but this is well worth like every penny I'm giving you, it's worth the treatment you're giving me. But like when I'm giving you money and I see like the doctor not even taking it all, like the corporate, like the owner of the hospital taking most of that money, I'm like, "Man, that
Yeah.
sucks. Yeah, I feel like the last 5 years, the whole internet call line, helpline has increased and has like helped
Like
immensely.
telemedicine.
Yeah, telemedicine, because like we
Right.
can do this, and you could answer a lot of my questions like this, and it won't charge me the same way that it would if I had to
Sure.
go to go to
Go
the.
see a
So I
provider.
think technology is a good option to help us too. We can do a lot,
Mhm.
and it has happened, um, but it's still, you know, depends where you live, where you work, what you
Mhm.
do. Your situation is completely different.
Do you feel like sometimes when you go to the doctor that you don't get the compassion and care and connection that you would like um, from a healthcare provider? Right now, there's that burnt out attitude, there's that burnt out mentality, and a lot of people are kind of functioning as robots, and there's not a lot of humanity in it.
As a patient, you want somebody that cares. You want somebody that listens. You want somebody that doesn't just listen to what they want to listen, but listens to what you want them to listen, and then presents a reasonable plan of action. One that doesn't include getting every little penny from you or your insurance company, but one that wants results for your well-being. That's what you're going for, right?
Mhm.
But that's where the corporate greed is directly connected to it. We experienced in the pandemic a shortage of workers. Why? They got squeezed. The people that were capable, that knew how to take care of, that knew how to do things, got squeezed from both directions. More demand from people needing more help, and no give on the hospital end of things. So they got jaded, like to the point where they weren't being taken care of. They were making the same money, spending the same time for 10 times more stress, 10 times worse conditions of work. Nothing was improving. They were risking their lives. They couldn't go back to their families because they were like all of a sudden giving up. They got the short end of the deal. So yes, Cass, you're going into a field where if the right things happen, you could be squeezed and then you will be tested. I gave every ounce of care I had for every patient that I saw, and then my manager told me that I was spending too much time with them and wanted to reprimand me. It risked my job security. Oh, I was told by this insurance company that I wasn't charging right, so they weren't making money. I got in trouble for just trying to cut this patient a break and give them the thing that costs less for them because I had empathy for their case. So if you're in the business long enough, you stop seeing patients, you start seeing numbers because at the end of the day, you want to go back to your child and maintain and keep your job and not have to go to more therapy just because you cared about every single person you saw. Your mental health is at risk. Then you don't want to risk your health by like being contaminated and shortcutting procedures when you probably could and might save somebody from dying if you did something one step faster, but you would have to risk being in contact with blood, being in contact with this if you had to do certain things, and then that shortcuts you. So yeah, in a way, we have to at the end fend for ourselves. You have to fend for yourself. So if the system doesn't cut you a break, the pressure comes from above and below. Yeah, you stop caring, and you can clearly see it as a patient when you walk into the rooms. Like this person has been jaded by the system. And
Mm-hmm.
if you're ignorant, I feel like I'm a pretty smart person. I can tell the ins and outs of things. But if you're ignorant and you show up, you just see this person like this person just doesn't care. Autumn tells me about her precious, her managers, crappy people that are miserable, and then they come in. There's the hospital environment, and then there's the doctor environment, and then there's the patient environment. She has to navigate those things, and she needs therapy for it because it's stressful,
Yeah.
you know. And then 5 years later, she's not as affected by the really horrible cases that come through the door because she's seen a lot of it. And then at the end of the day, the system did its thing. You know, I think it's a super deep. It goes with everything we talked about. It's a society conversation.
Yeah.
Um, So I want professionals to feel like every end of the deal, paid reasonably, be taken care of, not being overworked. The thing is like staffing. Like you see hospitals just short staffing on purpose and filling up the schedule. So patients are crabby. They walk in the door, they have to wait an hour, 2 hours to be seen. So they mistreat every professional that's looking at them. And my wife is there to take care of them. She has nothing to do with the scheduler that put two or three less people on the floor to work the same amount of patients or more,
Mm-hmm.
so they don't know. They thought they went to the hospital and they were going to see everything staffed, everything ready to go, and they don't know that she's like juggling from three different people doing the job of three people just to see
Mm-hmm.
this one person. The top is making way too much money with no empathy and
Mm-hmm.
no care for the patient
Well, they're
or the
not
people
seeing
that are
them.
working. They don't see it. They don't have to deal with it. They're just looking at the bottom line, and then
Looking
they're
at the
putting
numbers.
and they're pressing down the chain on the workers. And
Yeah.
people like you who care might get in trouble for caring. It sucks.
Mm-hmm.
Why would you ever get in trouble for caring about your patients? But that ends up being like that.
Mm-hmm.
So I
It's especially like that in the pre-hospital. It's like time. Like,
yeah,
why do you spend so much time on scene, you know?
yeah,
And it's case dependent, but
of course. But to think that the patient doesn't notice would be silly.